Hi, I'm Congressman Jim McGovern. As you know, the debate over health insurance reform is ongoing and spirited. Recently, a lot of news coverage has focused on the debate over the debate. In other words, whether or not anybody yelled or booed at a town hall meeting. I think it's important to remember what the underlying issue is, how our healthcare system is broken, and what the best way is to fix it. In many ways, we have the best healthcare in the world. We have the best doctors, the best hospitals, and the best technology in the world. But that doesn't mean that the current system is perfect or that it works well for everybody. It doesn't mean that everybody has access to that world-class care. Far from it. As I see it, there are three fundamental problems with the current health system: uncertainty, cost, and effectiveness. First, uncertainty. The fact that nearly 44 million Americans don't have the peace of mind that comes with health insurance is something we must address. After all, when one of those uninsured Americans gets sick and goes to the emergency room, the hospital is reimbursed by the federal government for its costs. In other words, you and I, as taxpayers, are paying for an extra surtax to provide health care for people who do not have insurance. But the vast majority of health care casework that my office does involves people who actually have health insurance. They have paid their premiums and they expect that their insurance to be there for them when they need it. But when they get sick, suddenly the insurance company refuses to pay for needed care. Under the proposals currently in consideration in the Congress, insurance companies would be prohibited from employing those kinds of practices. People with insurance would finally know that they will get what they have paid for. It is important to note that more than 90% of all employer-sponsored plans offered today are likely to meet or exceed the bill's minimum standard of coverage. In these cases, employees would not see any changes in how they use their plan, the doctors they choose, or the care they receive. The remaining plans will have until the end of 2018 to make these common sense adjustments. For senior citizens on Medicare, the bill would reduce the size of the so-called donut hole in Medicare Part D prescription drug benefit by $500 in 2011 and then completely eliminate the donut hole over a period of years. The bill will eliminate co-payments for preventive services, Medicare, and will improve low-income subsidy programs to help ensure Medicare is affordable for those with low and modest incomes. The bill also strengthens Medicare by extending the solvency of the Medicare Trust Fund by at least 5 years. Second, cost. Currently, healthcare expenses take up about 17% of our gross domestic product, our entire national economic output. In other words, of every dollar spent in the United States on anything, 17 cents is spent on healthcare. That number is growing and growing fast. It is estimated that by 2080, around the time that my kids are retired, healthcare will take up 50%, half of our entire economy. That level of spending is simply unsustainable. If left unchecked, it will bankrupt us. We cannot and we must not pass that kind of burden onto future generations. I believe we should eliminate the waste, the fraud, and abuse that occur in the system. We should encourage technological innovations like electronic medical records to cut back on wasteful administrative expenses. And we should encourage preventive care to keep people from getting sick in the first place. Third, effectiveness. Right now, the United States spends far more per person on health care than any other country in the world. But what does all that money get us? Even though we lead the world in spending, the life expectancy of the average American ranks 30th, right below Bosnia in the world. I like to use this analogy. Imagine you're in the market for a new car. You go into the showroom and a particular model catches your eye. When you look at the sticker price, the car is by far the most expensive one there. But when you go home and check Consumer Reports, you discover that the car ranks 30th in safety and reliability. Would you buy that car? Of course not. But when it comes to healthcare, we are buying that car every single day. And I believe we can do better, and we must do better. I know that in an era of the 24-hour news cycle, talk radio, cable news, shout fests, and the internet, there's a lot of information flying around. Some of it is inaccurate. Much of it is confusing. Healthcare is a big deal. People should be concerned that we do this right. Earlier this month, I participated in 4 healthcare forums hosted by local hospitals. While a very small minority of participants only wanted to disrupt the events, the vast majority of people who came had thoughtful, knowledgeable questions and concerns. In the weeks and in the months to come, the various health insurance reform bills in Congress will begin to take shape into one piece of legislation. At that time, I will hold a telephone town hall where people can call in to let me know what they're thinking. Please check back on my website, www.mcgovern.house.gov, for details. In the meantime, please feel free to call or email my office on this issue or any other issue. Thank you very much.